May is National Stroke Awareness Month. It's a great reminder each year of how to recognize the signs of a stroke, as every second can make a difference. And it's not just older folks who are at risk. Data shows more strokes are happening in people aged 49 and younger. Joining us live this morning to discuss is neurologist Dr. Wally Wazni. Doctor, thanks for being with us this morning.
Thanks for having me.
So walk us through this. What happens to your body when you have a stroke?
Yeah, so when you have a stroke, there's two types of stroke. There's an ischemic stroke, which is a clot that forms in the blood vessel that supplies the brain. And then there's a hemorrhagic stroke, which is a bleeding on top of the brain. And so what happens with a stroke is that, your brain lacks oxygen and starts to, not work as well, and you start to develop neurological symptoms.
And who is most at risk for either of those?
Yeah, so the people most at risk are people with high blood pressure, diabetes, heart disease, and abnormal heart conditions like atrial fibrillation.
And this was a surprising statistics that I read this morning. Data shows more adults 49 and younger are having strokes. I could not believe this. What is behind that rise?
Yeah, the data really isn't out there, but I think we need to live a healthy lifestyle, and we're starting to realize that things like early onset diabetes and high blood pressure, typically if we're not seeing our primary doctor to get those medical conditions treated, that's going to put us at the highest risk for stroke.
Wow. Okay. Many people don't necessarily know what to do when someone is having a stroke. So time is of the essence, especially with something like that. How long do you have to get someone help?
Yeah, that's a great question. So, really we've made, significant advancements and in the treatment of stroke. So I think it's important that everybody understands that, our medications now can, almost completely reverse or even reverse acute stroke. So, really we have a time window for the clot busting medication through the IV up to 4.5 hours. And now we can do something called mechanical thrombectomy, which is actually go in minimally invasive into the actual brain vessel itself, remove that clot, and we can do that up to 24 hours now.
Oh, wow. That's fantastic news to know that we can do that so quickly. Let's say you have a loved one who has a risk of a stroke. What are the warning signs that you should be looking out for? How would you recognize it in them or possibly in yourself as well?
Yeah, I mean, there's really two things that I tell my patients. So the first thing is something called the TIA, which is a transient ischemic attack. And that's a neurological disability that happens, for a short time. So let's just say you have trouble speaking for a few minutes, or you have left-sided weakness or right-sided weakness, or you have numbness and it resolves. So that's something called the transient ischemic attack, and that puts you at risk for stroke within the next 90 days, up to 20%. And then the other thing is just recognizing a stroke. So we like to use the mnemonic be fast, and that's a sudden onset effect of balance, your eye, your face, your arm, speech, and T is for time. You need to call 911 so that we can treat you as soon as possible.
All right. There are the signs of a stroke right there. Dr. Wally Wazni, we appreciate you getting this information out to the public. Very important stuff. Thank you so much.
Thank you so much.